Good evening, everyone. Thank you all for coming. My name is Denise Marte. I'm a fourth-year medical student here, and I'll be kind of guiding you through this evening. I know many of you have made long trips to be here with us to celebrate this special rite of passage. It is my great honor to welcome you to Warren Alpert Medical School's 20th Annual Ceremony of Commitment to Medicine. My first honor today is to introduce Dean Jack Elias. Dr. Elias is the Senior Vice President for Health Affairs and the 7th Dean of Medicine and Biological Sciences at Brown. A preeminent physician scientist, he brings to his role decades of experience as a National Institutes of Health researcher, a clinician specializing in pulmonary medicine, and chair of the Department of Medicine at Yale School of Medicine. Dr. Elias is a member of the National Academy of Medicine and served as president of the Association of American Physicians. In a professional career spanning more than 30 years, Dr. Elias has cared for patients with a wide variety of lung ailments and injuries and has conducted research on conditions including asthma, chronic obstructive pulmonary disease, pneumonia, pulmonary fibrosis, and the effects of smoking. His NIH-funded laboratory focuses on the cell and molecular biology of lung injury and repair. He earned his bachelor's degree and MD at the University of Pennsylvania, served an internship at Tufts New England Medical Center, and completed residency in medicine and fellowships in both pulmonary and critical care medicine and allergy and clinical immunology at the University of Pennsylvania. Please welcome Dean Elias.
Thank you, Denise. This is a very special day. I wish all of you could see the view that I have from here, to see the families, the friends, everybody who's here. It's just a wonderful sight, even with the sun right in my eyes. But in all seriousness, as Dean of the Medical School, it is my pleasure to welcome all of the parents, family members, spouses, and significant others and friends to your loved one's white coat ceremony. I want to have an especially warm welcome to the class, MD class of 2022. You are tremendous. This is one of the largest classes that Brown University has ever had in its medical school. The people in the class of 2022 hail from 30 states and the District of Columbia, and a variety of other countries by birth or citizenship, including Brazil, Canada, China, Cuba, Germany, Israel, Kenya, Korea, Poland, Switzerland, the Syrian Arab Republic, and the United Kingdom. Some of you just graduated from Brown a few months ago, while others, for you, this is your second career. In your young lives, you've been in the Peace Corps, worked for NASA, owned businesses, served our country, and many of you are former athletes. But wherever you are, you've come from whatever walk of life you've come from to, in my opinion, enter the best, absolutely best profession in the world. Today, when I place the white coat on you, I am welcoming you to the world of medicine. This is both a privilege and a great responsibility. You will have the privilege of being a trusted advisor in the lives of your patients. You will hold their secrets and be with them through momentous occasions in their lives, both good and bad. You will also have the grave responsibility toward your patients and their lives. You are committing to keep them safe, you're committing to make them well, and you're committing to always put their welfare first, even before your own. You will have days with impressive successes, and you should enjoy them. You will also have days of frank failure. In all cases, you must commit yourself to always striving to do better, and you need to commit yourself to being a lifelong learner. Now, one of the joys of being up here at the podium is it allows me to talk to the entire class, and no one has their cell phone out. So it's really a wonderful event, and we're not recording it and going to show it later. And it allows me to make 4 points that I want to make. First point is, the next 4 years of your life is where you have to find your passion. You're going to have wide-ranging experiences in the next 4 years, and you need to participate in each one with gusto. They're going to run the gamut from basic science to clinical science. They're going to run the gamut from primary care to complex tertiary care. They're going to run the gamut from public health all the way through to other forms of healthcare delivery. It is your job, by participating in each one to the fullest of your abilities, to find your niche in the wonderful world of medicine. You will need to get yourself in a position so that every morning when you wake up and you go downstairs, for the next 20, 30, maybe even, God willing, 40 years, and you're about to walk out the door to do X, whatever X is, it should put a smile on your face. If X puts a smile on your face, you've used your time in medical school well to figure out where you belong and what your calling is. Point 2, listen to your patients. Your patients have a story to tell you. They are your partner in the healing endeavor, and you need to really, really focus on the message that they're giving you. Point 3 is commit yourself to advancing knowledge. It is your responsibility that the next generation of physicians has new and more effective and more efficient ways to treat patients than we have now. I vividly recall, as a medical student, being in the laboratory of Dr. Peter Knoll when he realized that there was a chromosomal translocation in the cells from patients with leukemia. This translocation was initially called the Philadelphia chromosome. I was a medical student in Philadelphia. You knew it was going to be on the boards, so you studied it, and you had to get it down cold. What was truly amazing was that's all we knew at the beginning. But then somebody else figured out that 2 genes that didn't belong together just got spliced together, the BCR gene and the ABL gene. This became known as the BCR-ABL translocation. And then someone else came along and realized that the protein that came out of the BCR-ABL translocation was the driving force behind this form of leukemia. And then someone else said, well, if that's the case, we can block this protein, and maybe we can help these people with this form of leukemia. And they made the first drug of now many drugs that are based on the genetics of malignancies. They made a drug called Gleevec, and people in medicine got to watch a fatal disease go from a fatal disease to a disease we treat with a pill. It is a remarkable story, and it's a remarkable experience for me as a scientist and as a physician during that time. So my message to you is keep your eyes open and keep your thinking caps on. Medicine is far from perfect, and it needs you to make it better. The last point I want to make is accept the mantle of a mentor and teacher. Right now, I'm sure you're thinking, what's this guy talking about? I'm 1 month or 2 months into medical school, and he thinks I'm going to teach anybody anything. The answer is, don't kid yourself, but that day will come very, very soon. What I would suggest that you do is enjoy it, take it to heart, and take to heart the responsibility of passing on the knowledge that you're going to inherit, that you're going to learn, and that's going to be generated during your lifetime, and make sure that it's appropriately passed on to the next generation of physicians. Let me close by pointing out one more thing to you today, and that this white coat ceremony in many ways is a family day. You just need to look at the rafters to see the families that are here, and it is truly, truly one of the most wonderful days in our year. What I also need you to understand is even though you're here with your extended families, you're actually joining another family. The family you're joining is the family of the Alpert Medical School and the Brown University Alpert Medical School family. So during the next 4 years, please remember that the faculty and alumni are here for you and are massively committed to your growth, development, and success. Please accept their mentorship and guidance in the years to come, and let them help you get over the challenges as they present themselves to you. And remember, our doors are always open. Congratulations, class of 2022, and welcome.
Hello again. I want to give a special round of applause to the class of MD 2022 because this is a really big moment, and I think I think we should applaud that. Yeah. Right. When I was sitting in your seats 3 years ago, my heart was so full. I was overwhelmed with emotion, seeing my family, my friends, and everyone here for this moment. That same collective love, joy, and sense of pride is palpable in this room. I will not blame you if you do not remember what I said a few days from now or even a few hours from now. But I do want you to remember how donning the white coat in front of the people who love you makes you feel. I'm here to talk to you about these white coats and explain what all the fuss is about. The word ceremony is defined as an event of ritual significance. Today's ceremony is not simply about you putting on a coat that happens to be white. You've all put on coats before. And I'd even go so far and say that for some of us, buttoning up our coats as toddlers came with just as many cheers as the ones you'll be receiving today. Today's ceremony is, however, about the white coat becoming yours. What I mean is that today marks the beginning of your public commitment in front of friends, family, and your future colleagues to owning the white coat. The coats you will be receiving today have your names woven into them, which is amazing, and thank you to the Brown Medical Alumni Association, but it also means everyone knows it's yours. However, the charge of donning the coat is that it first and foremost is not about you. While you may be the person wearing the coat in your family pictures or down the hallways of the hospital, this coat is about those who help symbolically weave the letters of your name into it. And that is the villages of people that have helped you along the way. It's also about the villages that you have yet to be a part of. The people you will treat, the people whose lives you will touch, and those whose lives will touch you. My speech tonight is all about remembering and honoring those villages, because that remembrance and understanding will never lead you astray once you own this white coat. I will begin by sharing a little bit about my own village, because it has always defined what I've wanted to be in medicine. I could talk about my family forever, and I know we want to get to everyone putting on their coats. But I'll keep it short and focus on one key person who I'm glad to have here with me today. I was born and raised in the South Bronx in New York City. I'm the daughter of immigrants from the Dominican Republic. My father, Damien Marte, is still a building superintendent. They call him El Super for short, in the apartment building where we've lived for the past 20 years. That means his job is mostly to sweep the sidewalks and empty the trash bins for when the garbage trucks come around. I learned everything I know about what it means to help, to give, and to be there for others from my father. Whenever he wasn't busy with his normal day job, he was helping people in the community. For example, when family friends would move to New York from the Dominican Republic for the first time, he would be ready and waiting with free furniture he'd collected from all around the city. If they needed a place to stay while they got their feet on solid ground, he'd host them in his own home, giving up his bed, even me and my siblings' beds, for months at a time. He's helped more than 50 of our neighbors get their driver's licenses in New York City, waking up extra early to teach them both physically how to drive and how to understand what the driving instructor would say in English during the test. He did all of this outside of his job when no one was looking. My father was recently diagnosed with an inflammatory myositis. This means he has frequent muscle pain that causes him to miss work or sit out an evening or an afternoon here or there. It took 2 years and a doctor who sat down and really listened to his symptoms for my father to get a muscle biopsy, a diagnosis, and to start treatment. He's on a new medication that he says he only takes because it helps him get back to playing dominoes with his friends and waking up early on Sundays to teach new neighbors how to drive. My father taught me several things that I've carried over into my life in medicine. That I want to be known as someone who is there for others, who acts when they see someone in need or a problem that needs to be fixed, someone who lends a helping or in our case, a healing hand. I want to be the doctor that listens closely to my patients' social histories and respects how they perceive their health and how their health has affected their lives. I want to own my white coat even when no one is looking and when I'm not being paid. One of my favorite mentors and an incredible HIV doctor here in the Brown community, Dr. Joe Garland, always says, you don't get a pat on the back for doing your day job. And that's what a good doctor is to me. A good doctor does not simply wear the white coat during business hours, but owns it even when it's not on their backs. My father may not be a doctor, but he has always exemplified the values I have held dear throughout my time in medicine. Because of him, I try my best to honor the fact that I am just one other person in the world who can help others in meaningful ways. I am not the only one. This means I have to handle the privilege that this coat affords me with care and with humility. I get a lot of kudos for having a white coat, even from people who've never met me before. My father, on the other hand, doesn't get as many kudos when he's making sure the streets are clean for pedestrians in the morning. That is unfortunately society's limited view of who among us is of value. My responsibility to my village as the owner of my white coat is to practice humility, almost aggressively, because I would be nothing without my family. You all likely have a story from one of your villages about the person that helped you define what it meant to give, to help, to comfort. There are no new definitions when you put on this coat, nor should there be. The lessons you've learned and the values you've held dear because of the people in this room and their love for you, that may look different in a hospital or in a clinic or in a lab, but they will be the same values you'll be elevating to sustain your now lifelong commitment to people and to their well-being. The reason why I'm talking about the charge of donning this white coat is not because I want to scare you. It's because I want to offer some tips for how to best honor your villages while you're here at AMS. This stage of training lays the foundation for the rest of your career in medicine. So here are my 3 tips. Take care of yourself, take care of each other, and be the example you wish to see in this profession. Take care of yourself means being especially attentive to your mental and physical health. That means being as vigilant when you feel emotionally off as when you have a nagging cough. It also means being attentive to your relationships with the people who love you. Those relationships nourish you and make you whole. A whole doctor is one who can truly recognize the humanity in others as well as in themselves. Take care of each other. And here I'm talking about both your colleagues and your future patients. Medical school is hard, and many of us struggle. As much as it will feel like you're struggling alone, there will always be another person who is going or who has gone through it. Be the student who volunteers that you too have struggled. Be the one who lends the listening ear, the one who gives your classmate the list of resources. Be the one who notices a classmate was really affected by something on the wards, and don't stay silent. Take care of your patients too. One instant can separate you from the people you will meet with the most difficult diagnoses or the ones going through the most life-changing moments. Never forget that. Never forget that while we're all made of the same physical substance, we all have entire worlds and stories that give more complete pictures than what our bodies themselves will ever show. Always remember that your patient is a fellow human with a whole life just like you. Your ability to provide quality care to them lies in your ability to listen, to be present, and to treat them the way you would like to be treated. And lastly, be the example you wish to see in this profession. Unfortunately, not all of our identities are easily associated with these white coats. While you all have a spot in this class, some of you will struggle to find place in this profession. For some of you, a part of your charge will be to show your colleagues and your patients that you too can be a human suffering with mental illness or with chronic disease and be an excellent doctor in any specialty. To those who will not face these challenges, make room for others. Grow in your own awareness. Bring people up with you. And to those who will, share your identities if you're comfortable. The more we all enrich our understanding of who can own a white coat, the easier it will be for future generations of students filling these spots. So while you're here at AMS, just remember those three. Take care of yourselves, take care of each other, and be the example you wish to see in this profession. Now, back to this white coat. Today it becomes yours. Your ownership of it will rely on your ability to honor your villages, to have the pride necessary to be who you are and to make room for others, as well as the humility necessary to recognize every single human being as someone of equal worth. Embracing this ownership, even when you're not physically wearing the coat, will always guide you, even in the most challenging of decisions in the exam room and with fellow friends and colleagues. I wish you all great success and strength in your futures owning this and many more white coats. Thank you. Thank you. Now it is my pleasure to introduce Dr. Steven Dorsky, who will deliver the Charles O. Cook, MD, Distinguished Visiting Lecture. Established in 1994 through a request from Mrs. Ruth Cook Peterson, this lecture was created to provide a lasting benefit to the Brown medical community. We're very grateful to Mrs. Peterson for her gift, and today we're honored to welcome Dr. Dorsky to the distinguished family of Charles O. Cook lecturers. Now I'll read you his bio. Dr. Dorsky has been an active volunteer with the Warren Alpert Medical School for many years. He chaired the Brown Medical Annual Fund in its early stages and served in numerous other fundraising and advisory capacities, both for the medical school as well as the university, including Parents Leadership Weekend at Brown with his wife, Fran. Dr. Dorsky is a spine surgeon and the founder of New Jersey Spine Center. Dr. Dorsky completed his general surgical training at Albert Einstein College of Medicine and Montefiore Medical Center. He completed a residency in orthopedic surgery and fellowship in spine surgery at the Hospital for Joint Diseases Orthopedic Institute in New York City. He is also residency site director for the orthopedic residency at Rutgers, Newark, at Overlook Hospital in Summit, New Jersey, and previously on the clinical faculty at the University of Medicine of New Jersey. Please welcome Dr. Dorsky.
Good afternoon. Dean Elias, medical school faculty, our large contingent of proud parents, family, friends, and of course, our honored medical school class of 2022. Welcome. I want to welcome all of you to the white coat ceremony of the Warren Alpert Medical School of Brown University. I am honored to have the opportunity to speak today on this very special occasion. This building, where we are all gathered, has had an integral role in our collective medical school careers over the years. To date, more than 3,500 medical students have passed through these walls during their medical school education, marking important milestones. Early on, there were convocations here for the first day of class for the first-year students. Now we have white coat ceremonies, with everyone once again returning for graduation. Arriving here this afternoon with everyone in front, it seemed that everywhere I turned, I saw smiling faces of medical students, eagerly anticipating a special moment in their lives. It was great to see. All of you should be very proud of what you have achieved and how hard you have worked to arrive at this day. Today represents a pivotal point in your journey in becoming a physician. When you receive your white coat today, and Dr. Elias helps you try it on for the first time, there's a transformation, almost magical, that's going to occur for each and every one of you. You begin as a student of book knowledge, someone now becoming someone who learns to use that book knowledge and use that knowledge to treat patients. The white coat ceremony is a relative newcomer in the world of medical education, dating back to the 1960s. The ceremony was indoctrinated in Brown in 1998, and today we proudly stand here together, celebrating the 20th anniversary of this ceremony at Brown. We may not have been among the earliest to adopt the ceremony, but we are now 20 years strong, and Brown certainly does this with a bit of class. In fact, our medical school is also a relative newcomer. Rhode Island was one of the first, I should say one of the few states that did not have a medical school of its own. And there were long discussions that Brown should be represented by a medical school. Visionaries within the university and the state came together and joined forces to lay the groundwork for medical education at Brown. The program quickly grew in size and stature, with the first four-year MD class graduating in 1975. For many years, we were not fortunate enough to have a building of our own. Our school was centered in Arnold Lab. We borrowed classroom space, we borrowed labs. We managed, we were happy, and everyone said that one day we would have a building of our own. More recently, there was a groundswell of recognition by the university of what the medical school actually meant to Brown. With the efforts of many, a new home was constructed right across the river from here that has greatly benefited every one of us. When I completed the core curriculum at Brown, there were 2 years of basic sciences, followed by 2 years of clinical work. Times have changed. Now there is an integrated curriculum. You can even sit at home listening to your lectures in your sweatshirts. But the big news is that your clinical training now begins in the first year. So what's really so important about this white coat? What does it really represent other than a piece of cloth that we wear in a hospital to differentiate us from the visitors and show that we belong to the medical community. The acceptance of this white coat represents both an important milestone as well as a rite of passage into the clinical world. As you receive your white coat, there are expectations that you accept the privilege of wearing this coat. It offers an opportunity to reflect on setting the tone for your life in medicine as you take your initial tentative steps into patient care. Wearing a white coat brings with it a sense of responsibilities that at this point may not even be fully crystallized in your minds. I would like to share with you today a few of the responsibilities and commitments that I embraced as a physician and spine surgeon of, I will admit it, almost 40 years. Each of you will ultimately formulate your own path and direction, but hopefully some of what I share with you today will lead you to pause, reflect, and develop your own individual commitment to medicine. My first and greatest commitment has always been to my patients in providing the highest level of care. This responsibility became ingrained right here as a student. I try not to forget the patients come to see me for advice, help, comfort, hope, and just a bit terrified that they may require spine surgery. More recently, there have been imposed changes in medicine on all of us, and clutter, which now affects how we are able to practice medicine. It's part of the landscape. It makes it difficult at times for us to concentrate on the cornerstone of responsibility to our patients. We simply need to accommodate ourselves to the facts of life. So I implore that you listen to your patients with full attention, regardless of the distractions that might exist. What your patient has to say might even lead you in the right direction. Answer their questions, which they passionately want answered, and focus on being both kind and compassionate. These are lofty goals, but they do not come easily, as I can personally attest to as a fairly type A spine surgeon. I can sometimes lose sight of this myself and still need to refocus as I see every patient as an individual and not just a surgical case. I also feel responsibilities to my fellow physicians, including cooperation and respect for each other. I actually have a very important responsibility to myself, as well as others, to uphold not only a level of excellence in the care of patients, but as well as a level of ethical behavior that others will learn and want to rely on. My next thought is something that is both personal and often difficult for physicians to recognize. Pay attention to your own emotional, physical, and psychological well-being. Your life will always be busy, and it is important not to ignore your own health. Ultimately, taking care of yourself throughout life will help you be a better physician to your patients. Finally, I hope that all of you recognize your responsibility to this unparalleled medical school, recognizing the opportunities that it offers, the profound impact it will have on your life. When you graduate and exit through these doors with your diploma, make a concerted effort not to close the door behind you. There are many ways to keep the door open. Through the years, I have been actively involved and remain so, as I am here with you today. I have worn many hats on committees, mentored students in my office, interviewed and more. Early on, financially, I gave what I could, even when there was not much to give. There was always a way for you to remain involved and connected to your medical school. Give of your time, give with your effort, and do not forget to give of yourself financially. You will find it gratifying. While organizing my thoughts for today, one expression kept whirling around in my mind. I thought it was too simplistic, it had no place here, but I couldn't discard it. So what is this profound wisdom? I decided I would share it with you. In life, when shouldering the responsibility of being a physician, and not just a doctor, sometimes it is important to be willing to just step to the plate. So why step to the plate? Possibly it is that I just got caught up in the season. It is that time of year when it is not only fall, but it is World Series time, the highlight of the season for inveterate baseball fans. I'm still trying to get by the fact that the Red Sox got by the Yankees, but that's water under the bridge. When a ball player steps to the plate, he gets set in the box. There may be a little ritual, a little bit of fidgeting, but once he sets himself, eyes the pitcher, sees the seam of the fastball coming down towards him, there is nothing else in the world that has his attention. The boys of summer just give it their all. I reflected on my life and decided I am just one who's not typically afraid to step to the plate. I would like to take a few moments and just relate 2 short stories of occasions where I was tested and I was personally faced with difficult decisions that I had to make. It would really test my ability to step to the plate. The first story is really very simple. It's dinner. Eating dinner in a restaurant one evening, I heard the horrible screeching of brakes and a thud outside. The next thing I knew, someone was coming into the restaurant looking for help. Someone was crossing the street and was hit by a car, and they were lying in the middle of a busy street. I could have continued with my dinner, but unfortunately that's never been my personality. I decided that I needed to take a walk, and I needed to see what was going on. What I found was a woman in her 20s lying in the middle of a street. The crowd was insisting that we carry her to the sidewalk. Concerned in the back of my mind that she may very well have had a spine injury, I simply said, "Not so fast. Why doesn't everyone just try to keep the traffic away from us?" After speaking to her briefly, it became pretty obvious that she did have a spine fracture. She asked me how I know. I said, "Trust me, I just know." I sat in the middle of the street with her, talking and explaining that we were not moving without a spine board. She was transferred to a hospital, and I really never expected to hear from anyone again. It was a hospital they don't typically use on an everyday basis, and people just get caught up in the emergency room call schedules. Fast forward several days. I was in the car. It was a Friday. I was driving to Vermont to ski for the weekend, wondering what happened to her. Needless to say, with that conversation, I get to Albany, and the phone rings. One of the family members to let me know that their daughter was still in the hospital. I expected a simple thank you, and their answer was, as you suspected, there was a spine fracture. Surgery was recommended, and they wanted me to intercede and take over care. I could easily have deferred and said, "I'm out of town." Without much hesitation, I decided that I could always ski, and a young woman was asking for help, and I really did need to step to the plate. Turned around, and I came back. Skiing could always wait. The other story is about David. A number of years ago, I received a call from a very close family friend. Really, more family than friend. Someone old enough to be my uncle. It was 11 p.m. on a Saturday night. Not a typically good time to get a phone call, and it's happened way too often in my life. Apparently, David had a back problem, which I never knew, and he bought himself an inversion table. And if you know what an inversion table is, you hang yourself upside down by your ankles. Something akin to medieval medicine. The straps broke, the rest was history. He fell on his neck, he was quadriplegic. He wasn't moving his extremities. I received a call from his wife, who was at Hartford Hospital with him. She told me that the emergency room doctor said that he had the same injury as Christopher Reeve. You know, Superman. She let me know that David told her, "Take me to Steven. I'm not staying here. Not that he was going anywhere. Despite the injury, David was carrying on, insistent that no one was touching him. Picture this, middle of the summer, horrendous rain, wind, thunder, and he's saying that he wants to leave. Transportation was not a smart answer and potentially even disastrous. I was just not winning this argument, though. He was coming irrespective of what I said. I said to myself, really? Do I really need this? The results of treatment with this were probably not going to be pretty under any circumstances. And as a close semi-relative, that I really need to be responsible when things can go wrong, even under the best of circumstances. Over the course of a career, I have operated on countless close friends, their families, and everyone who meant something to other people. And it never fazed me. But somehow this was a little bit different. This was too catastrophic an injury, and this was not going anywhere. So I did what I do best when I don't know what to do. I have a long talk with myself. I said, do I need to do this? And I said, no, you need to step to the plate. David understood how I felt and continued to insist that he would not have it any other way. I already knew where this was going. David was the priority. So I was emotionally drained when this was done. I got lucky. He got luckier. And yes, he walked out of the hospital. When he came to the office in a few weeks, his first words to me were, I never had any doubt. I have found that stepping to the plate can be both difficult, humbling, as a critical assessment of what I represent in life. Making decisions, testing one's willingness to extend oneself, and understanding your personal life, at times, is really not even yours. Following what you believe in is the only proper answer, and it will define who you are in life. On a personal basis, I have been extraordinarily fortunate in life, between a wonderful family and an extraordinarily gratifying career, even though I did not end up where I originally anticipated, which was going to be academic medicine, which was just not feasible for me at that time. From my experience, I can say that Brown has had an impact on who I am, how I care for my patients, and my view of life. To me, stepping to the plate has involved not forgetting those responsibilities and expectations that come with the white coat that you are about to try on, and also not forgetting about Brown. I wish all of you congratulations on this marvelous honor, recognizing this very special day, representing an important transition, bridging your didactic and clinical experiences. Every time that you wear your white coat, it should remind you humbly of where you began, the path that you have chosen to follow, and to appreciate the fact that it remains a privilege to continue to wear this white coat and all that it represents. Be humble, be modest, be compassionate, be introspective, inquisitive in life, and never hesitate to step to the plate. I know I never do. Thank you, good luck, and I look forward to seeing everybody in their coats afterwards. Thank you. Thank you very much. Thank you.
Thank you, Dr. Dorsky. It's my pleasure to now introduce Dr. Preetha Basavia. She's the president of the Brown Medical Alumni Association. Dr. Basavia remains deeply engaged with Brown by interviewing, coaching students, hosting local Brown events, and serving on the BMAA since 2010. And she was recently elected to the corporation. Congratulations. She's Assistant Dean of Pre-Clerkship Education and a clinical professor at Stanford School of Medicine. After earning her MD, Dr. Basavia served as a primary care chief resident for Beth Israel Deaconess Medical Center at West Roxbury, VA, and an inaugural fellow in medical education at Harvard. She was one of the first hospitalists and the youngest firm chief at Beth Israel. Before joining Stanford in 2006, she served as medicine attending and in educational leadership roles at Harvard and at UC San Francisco. Dr. Basavia has received a Humanism Award from Harvard, National and Regional SGIM Educator of the Year Awards, and distinctions for exceptional teaching and mentoring. Please welcome Dr. Basavia.
Welcome, dear friends, esteemed faculty, staff, alumni, proud parents and family, and a huge congratulations to the class of 22. Woo! So on behalf of the Brown Medical Alumni Association, it's our honor to sponsor your white coats, and as you've heard, they are symbols and tools of this privilege, responsibility that you will use on this next amazing, magical stage of your unique journeys. So we're really thrilled to partner with you. You are our newest members of our community. You're the newest kids on the block. So you might be wondering, what are we going to do together? Well, we connect to the community, to other alumni, to students and advising. We host study breaks. We offer extracurricular grants. I've had folks stay at my home. We help to fundraise and volunteer, and we hope to really increase the impact of all of our alumni collaborations and to work closely with Dean Elias and our wonderful teams. It was not that long ago when I sat in your seats, but no need to figure out how long ago that really was. But I can still remember, and I can feel today, the embracing positive energy, that sense of community, and the incredible excitement throughout. So I'm going to take a moment to thank the incredible family, friends, staff, and faculty who are here to support you, and to give a shout out to each of you, our inspiring students. I'm a mom of 3 kids, so 3 daughters, and I am a big clapper, so yay to all of you. Winston Churchill said, "We make a living by what we get, but we make a life by what we give." And I know that each of you, through your talents, your advocacy, and your compassion, will be giving immensely and transforming lives. You'll be stepping to the plate, and you'll be honoring your village. So on with the celebrations. When I call your name, the audience will cheer once for you. You will come over here. You will meet Dean Elias to don your white coat and to take a photo. I'll then call the next name for the next set of applause. Are we ready? Yeah! Woo! Logan Abel. Fadwa Ahmed. Ashley Aldridge. Christopher Alvord. Marie Anderson. Lauren Ashford. Morgan Askew. Pauline Bagatellis. Camille Bahit. Alice Burns. Steven Bozier. Christy Blackwood. Haley Bliss. Anne Bokach. Matty Beeler Thatman. Brittany Borden. Mackenzie Boss. Juliana Brown. Kelsey Brown. Timera Brown. Anna Bistritsky. Jessica Tsao. Valerie Chavez.
Congratulations.
Jessica Chen. Claire Chin Fo. Natalie Choi. Anthony Cloyd. Allison Conca Cheng. James Connolly. Kiara Corcoran Ruiz. Drew Cox. Kyle Curtis. John DiBella. Amador de la Marced. Imshan Drolia. Colin Dickerson. Justin Dower. Gabrielle Dressler. Cameron Etabari. Robert Fain. Taylor Freeberg. Joey Gu. Matt Hagan. Hiba Halim. Laura Harnett. Jessica Hoffen. Selena Shea. Sarah Shu. Alice Huang. Joshua Hughes. Fernando Ibans. Gian Ignacio. Ian Aikida. Emily Jamurina. Peter James. Kelsey James. Skenda Jean Charles. Maximilian Jensch. Yelena Jimenez. Francis Kazel. Marga Kempner. Isaac Kim. Steven Kim. Brandon Kingry. Tobias Kirchway. Christopher Kohler. Wardrobe malfunction. No, I'm just kidding. Okay, yeah. Neil Kondamuri. Daniel Kraft. Wei La. David Lee. Hung Jin Lee. Daniel Lee. Paula Lee. Lauren Luther. Onash McKenzie. It's a dance. Samuel Malakovsky. Clara Mao. Siddharth Marti. Thomas Martin. Christina Mata. Mariko Maxwell. Ben Merman. Rachel Montoya. Christopher Myers. Diane Na. Matthew Navarro. Idara Andone. Elizabeth O'Connell. Jamie Otzer. Victoria Oliva Rappaport. Daniel Oliveri. Sheer Oren. Adeyemi Oshanubi. Benjamin Pallant. Scott Pardo. Emily Passarelli. Hannah Pfeiffer. Jose Perez. Lindsay Pileka. Sophia Pu. Ariana Price. Sovitan Rajudre. Mihal Reisky. James Robbins. Julia Rothschild. Kevin Savage. Cooper Schwartz. Nirali Shah. Pranav Sharma. Carol Shi. Christian Shigley. Zachary Silber. Sachit Singhal. John Slate Romano. Nicholas Strada. Osvaldo Subillaga. Jenny Tai. Edward Tai. Elaine Tran. Liana Travis. Nikisha Vagajani. Lindsay Vandergrift. Tanisha Vernios. Douglas Vilta. Conrad Wallach. Caleb Walters. Kevin Wong. Fatima Warsing. Patrick Wasserman. James Williams. Robert Williams. Roger Winters. Parker Woolley. Esther Wu. Michelle Shong. Thomas Yi. Odette Zero. Victoria Zile. Belinda Joe. Chloe Zimmerman. Congratulations, class of 2022!
Thank you all. Let's give them one more round of applause. Thank you so much for coming today to celebrate with us. Just a few quick announcements before you start to head out. All families and students are now invited to attend a reception at the medical school. There is shuttle service available to and from the front of this church to the medical school until 7:30 p.m. And last but not least, I ask the MD class of 2022 to stand and applaud your families and friends as a thank you for all their love and support.